appropriately. By definition, any heart rate under 60 beats per minute is a bradycardia. A heart rate of 60 or even much less does not in itself raise a red flag, but in the clinical context of certain signs and symptoms can and does become a red flag. Bradyarrhythmias result from a specific cardiac or systemic disease process that leads to either a depression of sinoatrial node activity or delays in conduction. Causes include, but are not limited to, these here. Organic heart disease, that's going to be the number one. Ischemia, someone could be having a heart attack and present with bradycardia. Rheumatic heart disease is still big. Lyme affects conduction of the heart. Infiltrative, this is much more rare, like sarcoid or amyloid. Abnormalities, electrolytes, this is a big one, hypokalemia. And then drugs, overdose of beta blockers, DIG, things like that. Degenerative diseases, very common in the elderly. For each decade, a person after about age 60, the heart rate will keep decreasing by a certain percentage. So it's not unusual to find a 80-year-old or around there to be pretty bradycardic. Hypothermia, another big one. Hypothyroidism, extreme hypothyroidism. Exaggerated vagal tone, if you do a Valsalva or carotid massage or stick your face into a sink of freezing cold water, you get the diving mammal reflex and it'll slow your heart rate down. Bradycardia can also be a trained athlete effect. When I was in medical school, I was really quite a jock, and my heart rate was about 34 beats a minute. My professors used to say, "Do you even have a heart in there beating?" So you can get them pretty slow, and all it is just a sign of being in really good shape if you're a big-time runner or whatever you do. The need for emergent treatment is determined by the presence of symptoms associated with the bradyarrhythmia, such as syncope or lightheadedness. So keep that in mind, syncope or lightheadedness or loss of consciousness and fainting. Also chest pain, shortness of breath. Okay, so just memorize those symptoms because they're going to come back to haunt you throughout the entire course, even if it isn't cardiac. Okay, so you got syncope, lightheadedness, loss of consciousness, chest pain, shortness of breath. Always get a full set of vitals. Don't just take the pulse. Check a blood pressure too, for sure. You don't often have to get a temperature unless you feel there's a reason for that. Common signs of bradycardia requiring immediate treatment would include hypotension. So you're looking at blood pressure under 90. Okay, and especially if it's with any of these symptoms that I just mentioned above. Okay, especially then. Okay, pulmonary edema, that'd be a later sign, and that'll present with cough. They may actually be coughing up pink stuff. If they're doing that, they're in severe pulmonary edema, and that'd be a no-brainer. You know the person's not doing well. Shock. Okay, what is shock? Well, usually shock is tachycardia and hypotension. But in this case, it's due to severe bradycardia. So you'll see very low blood pressure and signs that go with that. So, and also poor perfusion through the lungs. So that'd be cyanosis. Pallor. This is pallor, when a person whites out, that's because their blood pressure dumps. Okay, and that clears their face of blood. Altered mental status, again, you're not decreasing your squash. Clammy or dusky skin, another sign of decreased perfusion. Clammy is because fight or flight mechanism is kicked in because it knows you're like in trouble. So you get clammy because sweating is part of that. Dusky skin would be, again, decrease in perfusion. Congestive heart failure, again, that'd be a late sign where you'd see elevated JVP, and then you'd hear rowels, and their feet would be swollen, but that would be a late sign too. They typically will already have swollen feet or swelling in the pretibial region. Heart rate is less than 50 beats per minute with clinical evidence of hypoperfusion. I like this one the most. This is kind of key, and it sums up everything you need to know. Okay, so heart rate less than 50, maybe even 60, with clinical evidence of hypoperfusion. So chest pain, shortness of breath, fainting, or getting goofy, not knowing where you are, stuff like that. That's 911, okay? If that's an elderly person or even an adult in their 30s or 40s with a heart rate of 50 with clinical evidence of hypoperfusion, 911, no question about it. Okay, try and get a history if you can. Find out if they have a history of any of these problems. Bradyarrhythmias may progress to complete heart block, which is an emergency. You don't need to get concerned about that because you'd have to have an EKG to make that diagnosis. Treatment, that all depends on what's causing it. So if they're having a heart attack, making their heart beat slow, obviously you treat the heart attack. So usually by the time you get them into the emergency room, atropine's first-line agent. So atropine. You give them enough of that, and if nothing happens after that, then you might have to go to some bigger guns like isoprel, which is a beta agonist, so that'll just speed your heart rate up. Dopamine, possibly. Epinephrine, possibly. Or external pacing, which is probably what they'd go to. External pacer. Okay, in anesthesia and surgery, we just give them lots of atropine. If that doesn't work, sometimes you'll go to something else like isoprel. More often than not, though, you're going to have to find out what the heck is causing it. Could very well be a heart attack if it's during surgery. Note if your patient is symptomatic with lightheadedness or altered mental status, lie him or her on the floor with the legs up on the wall. This will donate several hundred cc's of blood to the brain and heart and may actually totally correct the situation. If it's in your office, it's more than likely due to that shock-like effect they get when first being needled, and sometimes even second and third times.